My name is Lynne Crooks. I'm a retired police chaplain, and I'm the mother of 50-year-old David Gregory. I am David's voice. David was normal at birth. His APGAR was 7. At 1.5 years old, I took David on the beginning of the course, trying to find out what was going on. He didn't talk, sometimes acted as though he was deaf, and in my own words was an absolutely beautiful whirling dervish of a little boy. I took him to the pediatrician and he said he's just simply a second child. Doesn't have any reason to talk. And yes, ma'am, he is hyper. At 2 years old, David was recognized by mental health officials as being developmentally delayed. We spent almost 3 months going to a counselor while he talked to me. Finally, I told him, my other 2 kids don't have these same behaviors. Isn't there some kind of test we can do? A department head at Arizona State University, Speech and Hearing, confirmed that David was hyperactive and non-responsive, but she wasn't able to do any testing because he could not sit still. He couldn't pay any attention to whatever she was asking him to do. When I asked the woman, what is wrong? She gave me one of the best answers I've ever had. She says, this is no better question to ask. What can be done to help David now? I was also diagnosed as being extremely hyperactive. The professional that said that was the head of a department in a population of 300,000. Most hyperactive child he'd ever seen. David used to have what I called as catastrophic reactions. If you didn't know it, you'd say he's having a temper tantrum. He would throw himself around, scream and thrash, and sometimes hit his head against something. I pulled a car over once to keep him from banging his head against the car window. I never could figure out what was causing it, just the fact that David had somehow reached his limit. David wasn't accepted into public school when it was time for him to go to school, so we moved from an Army post to Tucson in 1974. There, David was allowed to go to school. He was one student in a class of 2 with one teacher. And it took almost the first half of the year for David to learn to be able to come to school. And then by the end of that first year, he could go to school. He learned to do a lot of things in the classroom by compliance. His father received orders for a 3-year assignment to West Germany, and he went immediately to Germany. We moved back, the other 2 kids and I moved back with David to Fort Collins, which is our hometown. But there wasn't any school for David. Not in West Germany, not in Fort Collins. They had one day attempt to put David in school. And after that one day attempt, they said, David will be homeschooled. The teacher will come to your house twice a week. Well, I'd reached a dilemma. Was I going to stay in Fort Collins with no school for David and no father for the 2 kids, or what was I going to do? I made what I thought at that time was the best choice. I went to Germany. Colorado Department of Human Services and Welfare people helped me find a live-in home for David. He was 7 at that time. And that home had over 20 other children. These children were bused to a special ed school in the area. During the 2 years that I was overseas, he was moved twice. Once because the first home closed due to insufficient funding, and the next time because my parents, whom I'd given legal guardianship while I was gone, moved him out and moved him back into their home. So I returned to the States as a single mom with my daughter, and I had sole custody of David. With the help again of Colorado Social Services, David was entered into a group home in Puebla that had between 8 and 10 children in it. However, during this time, David's behaviors became more intense, and the public school was simultaneously saying that David was just becoming unmanageable. I took one day off for work, one personal day off for work, and it almost cost me my job. But David was transferred to Grand Junction Regional Center in Grand Junction. He lived there in a building with about 25 other children of his approximate age. He was bused to public school and later on to the public high school. This school worked on his social and day-to-day living skills. It was a special ed school. David learned to add 2 numbers columns of math correctly, but we could never figure out if he just memorized it or if he really knew what he was doing. He could read words, and at that time his IQ tested at 5 years and 8 months. Finally, at 21, David was diagnosed: autism spectrum disorder, obsessive compulsive disorder, intermittent explosive disorder, moderate intellectual disability, and attention deficit hyperactivity disorder. There were many ups and downs that followed through David's teen years and early 20s. Just more behaviors, physical injury to himself. He destroyed property and hurt himself when he was destroying the property. Medication changes, and medication changes, and medication changes. And did I say more changes? To say that he didn't do well in the larger group is an understatement. Here I need to tell you that David never has ever hurt anybody else. It's only himself that he hurts, and it's when he's out of control. You may all not be aware that Colorado law allows the regional centers to call the police and remove a client to take them to jail in handcuffs if that client is too volatile. So David went to Grand Junction Jail several times. I've been driving back and forth from Aurora to Grand Junction for meetings and physicals and that kind of thing. One day I received a call that David had been taken to jail again. And then later on that day I found out that he'd been taken to Pueblo Mental Health Hospital. So this was 1994. I drove to Pueblo only to be told that I couldn't visit him because he was on mental health hold. So I turned to attorneys. They got me in within 2 days. And there, my 20-some-year-old son was in a diaper, on a table, in 8-point restraints, and extremely drugged. The next time I came in to visit, David was sitting in a chair that had an attached tray, and he had food in front of him, and he was drooling because he was in a stupor, but he knew who I was. I got him up, and we walked around, and he went over to a window, and he leaned against the wall and looked out the window. I told him that I would get him back into someplace soon as fast as I could. David was then back in Grand Junction. My attorneys began working with me to move him to Wheat Ridge so that I could be a stronger and more present advocate to protect him. When David first came to Wheat Ridge, many of the employees were very cautious of me. That's because I brought my attorney with me. I just wanted to make sure that I could do everything I could. That attorney told me that it could have been a lawsuit against Pueblo. I didn't think that was a smart kind of action at all. So that would only put my son in a place where he wouldn't have anything to take care of him because the state wouldn't take care of him anymore. At Wheat Ridge Regional Center, the care was more adaptive and he had less people. And I want to be certain to say here to reassure you that Grand Junction services are also the same now. I'm not knocking that, please. Since 1996, David has lived under the care of Colorado on federal funding for the disabled. He currently lives in a group home that is located in Golden, Colorado. He eats and sleeps in this home with 7 other clients who have also been diagnosed as having autism spectrum disorder. Each client has varying disabilities for comprehension, safety awareness, and individual needs to keep them healthy and safe. 4 individuals have their own beds. David is one of them. The house is an ICF, immediate care facility. It is licensed to serve up to 8 individuals. The capacity is reached. It has 2 resident bathrooms and 1 staff bathroom. It is staffed 24 hours a day, 4 on first shift, 4 on second shift, and 2 awake overnight staff on the late shift.
Lynne, you have about 30 seconds left.
Oh. Okay. Five residents, including David, have been categorized as long-term. They have been residents under the care of Colorado and federal government care for a much longer time. The Wheat Ridge Regional Center is now calling everybody short-term. They come in only as short-term. The push to move out the clients, like David, has been vigorously fought by the guardians and parents, myself as well. Be happy to put you in contact with any of them if you'd like that information. The fact is, and this is really important, there is no care in Colorado anywhere that can take care of David and these other adults like him to keep them safe and healthy and well. I'd like to add a little bit. I'm a member of a church in Elizabeth, Colorado. As you know, it's a very small town. The church has a population of about 200. There are 2 young men in that church population. One is 16. He's autistic. He still walks on his toes because they can't afford the heel cord surgery that David had. And he's, of course, struggling. He's being raised by his grandparents, and both of them have very serious health issues. The other one is a 10-year-old boy. He's being raised by his parents, and this year the school has finally gotten around to doing a little bit to help him in the public school. David is not able to care for himself. He requires your assistance to assure he lives safely and to the fullest of his capabilities. I speak for my son, David Gregory. Please hear him.